Well, according to the National Institute of Mental Health, more than 16 million people in the United States suffer from serious depression. It often gets worse without proper treatment. New data from the landmark guided study showed that when doctors use what's called the GeneSight genetic test to guide medication selection, there was major improvement. And Dr. Sagar Parikh and Karmala Walgren are here to tell us more about this. Doc, let me start with you. How big a problem is depression in the United States, and what are the symptoms?
Well, depression affects more people in terms of disability than heart disease or cancer. And it hits you in all conceivable ways, not just how you feel in terms of sadness or inability to enjoy things, but physical problems, problems with energy and sleep, thinking problems in terms of pessimism and, dark thoughts of death and so on.
All right, currently what are the treatment options for people, and what is the goal of the treatment? Obviously to cure them or just to help them maintain it?
Well, of course, it would be great if we had a total cure, but what we do have is an excellent chance for getting the disease under control. Psychotherapy and antidepressant medications are the two best studied and best treatments for depression. And the goal is really to get someone not only feeling well, but functioning normally, back to their usual selves, back to their usual life.
And Karmala, let me bring you in here. What was your experience with your depression and your experience with antidepressants?
My experience with depression was a long and difficult one. I had 50 years of being depressed. I was 22 years old when I was first diagnosed. For me, depression felt like a very real physical pain. It felt like a lot of pressure and pressing on me. People say, I was so depressed I couldn't get off the couch. Well, in my case, I felt like I couldn't get the couch off me. My experience with the antidepressants was one that took many, many years to find the right medication, but this GeneSight test really helped me a lot, and I got off the wrong medication, and now I'm taking the right medication. For the past year and a half, I have been in remission. I have been well, and I will continue to be that way.
And Doc, how does this GeneSight genetic test help the patient? How does it guide through? How does it work?
Well, first of all, good thing is that it's not a blood test. It's a simple cheek swab, and you send it off to a lab, and you get a printout later that tells you the common treatments for depression, the antidepressants and so on, and they're categorized as to which ones might give you trouble and which ones are likely to be smooth for you. So you and your doctor can select a medicine based on those characteristics, and it should make the choice of an antidepressant much better that way.
And Karmala, I just want to finish with this. How are you doing today?
Today I'm doing great. I'm 72 years old. I'm happier than I've ever been. I don't know how many other people when they're 72 are able to say they're happier than they've ever been, but because of taking the right medication, I am happy. When I'm 82, I'm going to say I'm happier than I've ever been, and when I'm 92, I'm going to say the same thing. I'm going to stay on this medication.
Absolutely, absolutely. I appreciate you sharing your story. And Doc, where can people get more information?
Well, for information about depression, go to depressioncenter.org from the University of Michigan. And for information on the GeneSight test, you can go to genesight.com.